Right, thank you and good morning, Flo. First time here. My 6-year-old daughter did prep me and said I would feel anxious and excited, so she's right. So I'm Samantha. I am a licensed clinical social worker and I'm division manager with Behavioral Health Department over a new division called Access and Crisis. And a part of our vision with this new division is to build a really strong and robust crisis continuum. And today I get to talk to you about a part of that, the Community Action Team. So the Community Action Team, as Jim said, is a co-response model to crisis intervention. So it pairs a law enforcement officer who's been trained in crisis intervention, at least 40 hours of that, with a licensed behavioral health worker. In our community, we use licensed psychiatric technicians and a mental health nurse because they're experts in de-escalation, they can administer medications in the field, and they can connect folks that are having a mental health or substance abuse crisis directly to a clinic or service that we provide. The primary goal of the Community Action Team is to prevent use of force when law enforcement is going out on and responding to a mental health crisis. I'm sure you've heard in the news when individuals have perished when there is that response, and so a huge goal of ours is to prevent use of force and divert individuals away from the criminal justice system and into appropriate treatment and services. So there's a revolving door in our community, just as there is across the whole state of California and the country, where people are bouncing from homelessness to the jail, to the psychiatric hospital, and around they go. So CAT, our Community Action Team, is kind of a wrench to throw into that system. So I'm first going to start by sharing a text message that one of my psychiatric technicians received from an individual. Hey, yes, I got my medication. My mom picked them up. She is here now at the riverbed. I'm packing the last few things and heading to residential treatment in about 20 to 30 minutes. Thank you all for everything, and if I need help with anything else at all, I'll definitely call you. Again, thank you, and please tell the officers thank you and I appreciate them and everything they did to make this possible. So that individual had a really lengthy criminal justice history, untreated mental health symptoms, and an untreated substance use disorder. In between responding to these 911 mental health calls across the county, the CAT team with their law enforcement officers do ongoing outreach and engagement. So they're going down into the riverbed, they're going into these encampments, they're getting to know folks on a first name basis and offering support, help with basic needs, what have you. And so CAT started really slow with this individual. There was not a lot of trust between this individual and law enforcement. So they started just getting to know her. What happened to you? Why are you here? What are your goals? They helped access basic needs for this individual, applying for general assistance, food stamps, and eventually actually brought the clinic to this person in their encampment. We can use telehealth to connect someone to psychiatric services, see a psychiatrist via telehealth, and then administer an antipsychotic right there in the field, where typically people are most comfortable in their home setting. So once her psychiatric symptoms finally started to subside as a result of this medication and having this consistent engagement with this team, she was ready to address her substance use disorder. This was a huge thing because she was also about to lose parental rights over her children, so she was effectively homeless as a result of all these issues and totally disconnected from family. I'm happy to say now that she is sober, she is housed, and she is re-engaged with her family. And as you can see, she saw law enforcement as an actual very important part of that puzzle and in her getting the treatment that she's needed. So I'm really lucky as the division manager. I get to oversee, right now we have 4 psychiatric technicians, one with the Tuscadero PD, one with Paso PD, one with the SLO Sheriff's Department, and then a mental health with the SLO Sheriff's Department. Their office is a patrol car. 40 hours a week they are riding along, responding to these 911 mental health calls, and then doing this case management and this hand-holding. And I'm really excited to say that we are now partnering with the San Luis Obispo Police Department and the San Luis Obispo Fire Department to put 2 psychiatric technicians in their agency so we can bring this really successful model to the city of San Luis Obispo. So I hope to see the results happen quickly. I know that the homelessness issue is a crisis here as everywhere. So we're going to get a little more creative and figure out how we can help these folks live their best lives. Thank you.